Meeting with patients in Launceston's General Hospital's busiest ward.
How are you, Mr Hayward?
Yeah, good.
With a strong promise backed by the federal government.
You had a bit of a joint replaced.
To give 2,000 Tasmanian patients access to elective surgery over the next 2 years via the federal government's pledge of $23 million.
The difficulty with the previous state Labor government was that you could give them money and you wouldn't be assured that the money was going to be spent on patients.
The money will be spent on a needs basis across the state's hospitals. It tops up the state government's $76 million funding for elective surgery over 4 years, including $16 million this year.
We know that our additional investments in frontline health aimed squarely at Tasmanian patients in actual fact provides job opportunities for doctors and nurses and job security.
The Greens say it will only buy short-term popularity for the Health Minister.
And the hospitals are bracing for an impossible situation of overwork, an overloaded system that will not be able to cope unless we get those federal agreements back in place that the Abbott government has cut.
Tasmanians are smarter than the Health Minister gives them credit for. Tasmanians know that the federal Liberal government's ripping more than $1 billion out of their health system.
Meanwhile, the Nurses Union says its members were yesterday refused a meeting about the state budget at the Launceston General Hospital.
The adversarial culture that's now unfolding in Tasmania in the public sector is concerning for all of us.
The Health Minister later intervened and allowed the meeting to go ahead.
It's just good sense, and it's entirely appropriate that we be able to provide meeting space for that kind of activity.
Meantime, the Environmental Protection Authority is working with Mineral Resources Tasmania to assess the environmental impacts of an alleged acid spill which occurred at the Razorback Tin Mine near Zeehan, which closed almost 40 years ago.
And if reports are correct that we're now seeing heavy metal contamination out of that mine, it actually raises the issue of the need for proper scrutiny of mines before they're approved.
MRT says any threat to public safety is extremely unlikely. Jessica Amir, WIN News.